Today, we are having a question and answer session on Down syndrome. Sitting opposite me is somebody that has a relation living with Down syndrome. So can we have your question now?
What is Down syndrome?
Down syndrome is a genetic disorder. It is not a disease. It is a disorder of chromosome 21. Every human cell has 23 pairs of chromosomes, making a total of 46 chromosomes. But with people suffering from or living with Down syndrome, they have 47 chromosomes. The problem is with chromosome 21. Instead of having 2 pairs, it has 3 chromosomes. And so that gives it another name of trisomy 21. This trisomy 21 is the commonest type of Down syndrome. It constitutes about 95% of people living with Down syndrome. Any other question?
Why is it called Down syndrome?
It is called Down syndrome because the first person that described that syndrome is a British-based physician called John Lyndon Down. He described this syndrome, and so the syndrome was named after him as Down syndrome.
Are there types of Down syndrome?
Yes, there are 3 types of Down syndrome. Like I earlier mentioned, there is trisomy 21. That is the commonest type. And that's the type that describes most of the features of Down syndrome we talk about. Other types of Down syndrome are translocation Down syndrome and mosaic Down syndrome. Those ones are rare. They are about 3 to 4% and 1% respectively.
How do you identify a person with Down syndrome?
A person with Down syndrome can be identified with the following features I'm going to mention. But these features are to create awareness, so that when you identify people with it, like here in Nigeria, we say they are caused or is an attack, is to help you know them and give them the support they need. It is not for stigmatization. The features commonly seen in people with Down syndrome are small low set ears, their nasal bridge is very flat, the eyes are widely set and slanting. They also have short fingers. The first and second toes are widely set apart, and then their muzzle tones are very weak. When you see anybody with these features, they call them almond-shaped eyes, low-set small ears, flat nasal bridge, weak muzzle tone, short fingers. They have special facial features. You can suspect the person has Down syndrome.
What are the risk factors?
The risk factors for a pregnant woman to have Down syndrome, the risk factors are late maternal age, advanced maternal age, women above 35, and elderly men have higher tendency to have children with Down syndrome. Also, people with family history of Down syndrome have a higher tendency of having children with Down syndrome.
Can it be prevented?
Down syndrome cannot be prevented because it is not a disease. Yeah.
How can it be detected during pregnancy?
During pregnancy, screening tests can be done. Between 11 weeks and 14 weeks of pregnancy, there are some invasive procedures where blood is collected to screen if the fetus inside the womb has Down syndrome. If it is detected that the baby in the womb has Down syndrome, it is now left for the couple, the parents, to decide what they want to do, the next step they want to take.
Are there symptoms?
There are no symptoms of Down syndrome because it is not a disease.
Any preventive measure?
Preventive measure, there are no preventive measures because it is not a disease.
What is the life expectancy for people living with Down syndrome?
Before, it's usually said that people with Down syndrome don't live long. But with advanced healthcare and technology, we have seen people with Down syndrome live up to 60 years and above. So they can live as long as they can with good, adequate healthcare and support.
Why is it important to create awareness to Down syndrome?
It's very, very important to create awareness regarding Down syndrome, because if you know about Down syndrome, and a lot of people know about Down syndrome, they will be able to identify babies with Down syndrome and take appropriate steps to support them. They can be supported through physiotherapy and other things. There are other health issues that are associated with Down syndrome. Like people with Down syndrome have thyroid issues. So if you're already aware that this child might have Down syndrome, you will advise the parents to go see a pediatrician. And if it is diagnosed that they have Down syndrome, they could be given drugs to help their thyroid hormones, and they will develop faster if adequate care is taken. There are also other complications that are associated with Down syndrome. Things like ventricular septal defects or holes in the heart, things like celiac disease. When people with Down syndrome, some of them, when they eat food that have gluten inside, they tend to react. And so if you know about it earlier, you can do something about it. That is why it's important to create awareness of Down syndrome. It is not a curse. It is not a disease. It is not what the parents did not do right. It is just a genetic disorder that just happened in the process of the child developing. That's it about Down syndrome. I hope you are better informed now regarding Down syndrome.
Yeah.
Let's together build healthier and happier families. Let's create awareness. Let's share this video far and wide so that a lot of people will get to know about Down syndrome. In Nigeria, there are hundreds of people that are living with Down syndrome, but because of fear of stigmatization and lack of data, we don't tend to know about them. So let this video be shared wide so that people will get to know about Down syndrome and give them the support they deserve. Thank you.
Thank
I
you.
am Dr. Happiness.